Hi, my name's Carson, and I'm in the physical therapist group, and that's our team name. I know it's not very original or creative, but for our career, we are doing physical therapists. And so, some things about physical therapists is basically we help our patients get back to the physical norm that they want to be at. This can be helping people who got an injury or a sports related injury, surgery, or even more elderly people who are just going through the wear and tear of life and they want to get back to their younger self physically. So some of our job duties is it's very hands-on and physical. So modeling exercises for patients of the exercises that they're going to be doing, and then also there's hands-on work like massages and stretching patients as well. So for our environment, it varies a lot. You could, when I've gone to physical therapy, I was in an office, and there's a bunch of physical therapists that work there, and you work with a physical therapist, and they give you exercises to do. So it's just like a big office area with a bunch of different sports equipment. There's also, you could do it in a pool, you could do it on a turf field, on a track, outside at a park, or they could even come to your house. So the environment varies a lot. It's a very hands-on and physical job. So some tools that we use, it's pretty much just like there's so many different tools. It's a lot of like exercise equipment, but then there's a lot of like random stuff like lacrosse balls, tennis balls, scrapers. So there's I would say mainly like exercise equipment is what I'd categorize the tools that are being used.
Mental health concerns amongst physical therapists involve things like burnout, elevated stress levels, and the long-term effects that those things can bring, such as heart problems and muscle problems, postural problems, things that a physical therapist would need to go to a physical therapist for. But the American Physical Therapist Association devised an initiative that they call Fit for Practice. It encompasses the full scale of wellness, and it provides resources for each path to stress relief and emotional well-being, which is really important for a job that involves so much taking care of other people. There are 4 pillars introduced in this initiative, which are designed to target specific needs. Resiliency involves things like practicing mindfulness and gratitude, meditation, and even using music as a therapeutic device. Restoration involves things like a healthy diet, sleep hygiene, but also strategies for overcoming feelings of burnout. Movement involves not just the promotion of exercise and movement as something to help with your mental health, but the process of a physical therapist using their own knowledge of mindful movement on themselves at home. And lastly, practice health, which targets the more far-reaching elements of the physical therapist health career that may lead to mental health issues, which is the infrastructure of the workplace. And it shows you different ways of introducing mindfulness into your workplace and your practice itself in order to create a healthier environment for everyone.
Hi, my name is Jasmine, and I will be giving a quick overview of the types of hazards that physical therapists face in their typical day-to-day work environment. So the first one is biological hazards. Physical therapists often work closely with patients in rehabilitation settings, which increases their exposure to infectious and contagious illnesses. So, for example, if you're treating patients with like open wounds or respiratory illnesses, that can pose biological risks. The second one is psychosocial hazards. These are the mental and emotional demands of the job that can be really high. So dealing with patients with chronic pain or those with like slow progress, that can be really mentally exhausting and sometimes leading to like burnout and fatigue. And the third and most common is physical hazards. So one of the most common risks that physical therapists face is physical strain. This includes like lifting, repositioning patients, and this can lead to musculoskeletal injuries. And a piece of evidence I have, according to a study published in the Journal of Physical Therapy Science, musculoskeletal skeletal disorders are highly prevalent among physical therapists, with most commonly affected areas being lower back, wrists, hands, and shoulders.
What's up, guys? I'm Vahi, and we decided to pick physical therapists, and I'm going to be talking about how employers can reduce risk as a physical therapist. As a physical therapist, employers can reduce risk by focusing on ergonomics, proper training, and a safe work environment. First, they should ensure that therapists have adjustable equipment to reduce strain during patient care. I think that is one of the most important ones because that leads to injury. Secondly, ongoing training in body mechanics and lifting techniques to help prevent injuries. And thirdly, able to manage workloads and provide assistant devices like transfer belts or lifts reduces to help not cause any physical stress. And to sum it all up, by prioritizing safety and support, employers not only protect physical therapists from injury, but also improve patient outcomes and job satisfaction. Thank you.